Now you're going to see an example of a patient who is severely depressed talking to a healthcare provider. You will get to see signs and symptoms of the disorder as well as the therapeutic communication techniques that the healthcare provider is going to perform.
Hello, my name is Christina. I'm the nurse today, and I'll just be asking you some questions. Is that okay with you all? Yes. Okay, may I please have your name? Who? And your name? Yesterday. And how are you related to her? I'm her cousin. Is that correct? Okay.
Haley is demonstrating signs and symptoms of major depression when she is walking slowly and rigidly, has a slumped posture, does not verbalize anything, and shows no interest in grooming.
Okay, so is it okay if she's in the room when I ask you some questions? Is that okay with you?
A little bit about Haley's history is that she grew up without her mom. Her dad moved away when she was really young as he married another woman. She lived with her grandparents, but her grandmother had breast cancer when she was 16 and passed away. Haley was living with her grandfather, but recently he had a stroke and is now in a nursing home. Haley was in nursing school before her grandfather died, but she had to drop out as she could not afford all her expenses. Haley is now living in her own apartment with no other support.
And my first question is, what brought you here? 2 days ago, I went to her house because she wasn't answering my calls or my texts, and I wanted to make sure that she was okay. So when I got there, I found her in her room. She had taken a shower or eaten, especially after, I tried making her some dinner and she didn't eat. So I stayed the night with her last night and decided to bring her in today.
Other symptoms that Haley is exhibiting include no personal hygiene and social isolation. She has had a flat affect throughout the interaction thus far.
All right, Haley, can you tell me about how you've been feeling lately? It's all normal. No one cares about me. Can you tell me more about that? Last week I received a call from her saying that her boyfriend broke up with her. She recently just found out that she's pregnant with her boyfriend's baby, and she told him, and he got really upset, and that caused a big argument, and that's when he broke up with her.
Here, the nurse uses the technique exploring. She delves further into a particular subject, which is how Haley is feeling. Haley is a certified nursing assistant at a local hospital. She met her boyfriend there and he moved into her apartment a few months after dating. When Haley got pregnant, she told her boyfriend, they argued, and he broke up with her. He stated that he did not want a baby at this point in life, so he moved away. Haley has not been going to work for the past 3 weeks and has been isolating herself in her bedroom.
I see. Have you had any history of medical history of surgeries, any thyroid problems, cardiovascular problems? No, she's been healthy all day. What do you hear, Haley? I don't hear them, but I believe that you are hearing them.
The nurse used the technique encouraging description of perceptions. She asked Haley to verbalize what was being perceived. The nurse also used presenting reality. When Haley had a misperception of the environment, the nurse indicated her perception of the situation for the client.
Okay, I see that you're very upset about the breakup. What type of support system do you have in your life? Well, when she was young, her mom died and her dad abandoned her. Then she went to live with her grandparents. Well, when she was 16, her grandmother died, and just recently our grandfather had a stroke and is in a nursing home, so she really only has me. Well, thank you very much for talking to me. I'm going to go and get the doctor. He'll be here in a short time and see what we can do to help you. And if you need anything, just let me know. I'll be right here, okay? It was really nice meeting you.
The nurse used the technique offering self by making herself available to Haley. Throughout the interaction, the nurse also used silence to give Haley the opportunity to collect and organize thoughts. The nurse ends the conversation in a professional manner.